We head to East Africa, where Ugandan President Yoweri Museveni has imposed a lockdown on 2 districts at the epicenter of an Ebola outbreak, barring personal travel, ordering a night curfew, and shuttering public places. The health ministry says there have been 19 deaths and 58 confirmed cases of Ebola since the outbreak was first reported on September 20. Authorities say the outbreak is concentrated in the central districts of Mubende and Kassand and has not reached Kampala, the capital, despite a couple testing positive there. Museveni ordered Mubende and Kassand into immediate lockdown, imposing a dusk-to-dawn curfew, banning travel, and closing markets, bars, and churches for 21 days.
I've come back the third time to talk to you about the Ebola outbreak that we have in the districts of Mubende, Kyejegwa, Kassand, Kagadi, and Bunyangabo. Movements into and out of Mubende and the Kassand districts is prohibited. There will be curfew in Mubende and Kassand districts starting from 7 p.m. Sawa up to Sawa Kuminabiri Zekiro. A total of 58 confirmed cases and 19 deaths.
Now, Benard Lubwama, a senior epidemiologist at the Ministry of Health in Uganda, joins me to discuss these issues. He is one of the doctors treating Ebola patients in Uganda. Now, thank you, Benard, for your time.
You're welcome. Thank you.
The last Ebola outbreak in Uganda was in 2020 when more than 10 districts were affected. What caused this re-emergence of the virus in the country?
It wasn't 10 districts. It was, I think you're talking about the year 2000. That was the biggest outbreak before this. That was in Gulu. Okay, this is what caused this. We don't know. We don't really know the source of the Ebola outbreak. And being non-specific, we always will get sporadic outbreaks.
But now let's look at what the health ministry is doing. The ministry has commenced wide tests in the virus hotbeds. What other collaborative efforts are being put in place to contain the spread?
We've been supported greatly by the World Health Organization and the Centers for Disease Control Atlanta to come up and contain this, as well as the MSF. We have multiple partners around here. You can see in the background, in my background, these are the guys doing, we call it our command center for surveillance efforts. It's the field base in Mubende that we are using to try and contain this. And yes, there's been joint efforts to make sure that this really is contained, and we appreciate that effort. I think it would have been worse if this wasn't happening.
Now, let's look at the fears being expressed about this spread into the capital. A couple recently tested positive there in Kampala. How real are the fears of a possible contagion in the capital that may lead to a lockdown there?
Okay, thank you very much, sir. Once again, there is tough decisions have to be made if you have to avoid tougher repercussions. Now, these couples were people who, there is always be the stubborn ones. And these were the stubborn ones who had refused to cooperate with the health workers in the district. The others were, but these two had refused. So they ended up in the capital, in the National Referral Hospital, trying to seek care in another unit. They were in denial, saying this wasn't Ebola. But the beauty is we had alerted the different units within our hospitals, and they were able to pick them up on arrival. They picked up the gentleman on arrival, but the lady also had gone to give birth to a health facility somewhere in the capital, and they were able to pick her up early enough. before she could have that decimated spread to other people. Okay?
Yeah.
So that is where the containment is.
All right, that's a good one. But this latest outbreak we hear is the Sudan strain, and to the best of our knowledge, there is no approved vaccine for it. What is the government doing, and what can be done to effectively bring this under check?
Okay, yes. Thank you again. There's not been any vaccines on the market, but they are candidate vaccines. And later this month, at the end of this month, we will start the rollout of the vaccine. But still, just like it started when we started the Ebola Zaire vaccine, it will be purely compassionate use, and any person who volunteers for the vaccine will be welcome. And yes, there is one vaccine that we're going to roll out for that.
All right, thank you so much, Benard. We wish you guys success as you try to contain the spread of the virus.
My pleasure, sir.